Most heart attacks don't start with chest pain. In fact, the real warning signs often show up weeks earlier, and most people over 60 completely miss them. By the time they're clutching their chest in an ambulance, they've already ignored dozens of subtle signals their body was desperately sending. I'm Dr. William, and after 20 years of practicing cardiology, I can tell you with absolute certainty that the people who survive heart disease aren't the lucky ones. They're the ones who paid attention. They're the ones who knew what to look for. So today I'm going to walk you through 7 warning signs that your heart might be in real danger. Some of them will surprise you. Some of them you've probably already experienced and dismissed as normal aging. By the end of this video, you'll know exactly what to watch for, when to get checked out, and most importantly, which signs absolutely cannot be ignored. If you're over 60, or if anyone in your family has heart disease, this is essential information. So stick with me for the next 25 minutes. This could genuinely change the trajectory of your health. Let's start with the first warning sign, and honestly, this one catches most people off guard because it has nothing to do with your heart directly. Asterisk sign. Number 1, unusual fatigue that won't go away. Asterisk. Now, I know what you're thinking. You're 65, 70, or older. Of course you're tired sometimes. But I'm not talking about the normal tiredness you feel after a long day or a bad night's sleep. I'm talking about a fatigue that's different from anything you've experienced before. This is what I call unrelenting fatigue. You wake up after 8 hours of sleep and you feel like you didn't rest at all. By 2 o'clock in the afternoon, you're absolutely exhausted. Your body feels heavy, your brain feels foggy, and it just doesn't improve no matter how much you rest. Here's what's happening inside your body. When your heart isn't pumping blood efficiently, your organs and muscles aren't getting enough oxygen. Your body responds by feeling absolutely drained. It's like your car's engine isn't running at full power, so everything just feels sluggish. I had a patient, Margaret, 72 years old, who came in complaining about exhaustion. Her daughter had basically dragged her to my office because Margaret was sleeping 14 hours a day and still felt tired. Margaret thought it was just her age. Turns out, her heart was functioning at only 40% capacity. We caught it just in time. The key thing here is change. If you've never been this tired, and now you are, that's your signal. That's your body waving a red flag. Asterisk. Sign number 2. Shortness of breath during simple activities. Asterisk. This is the one that brings people to my office more than almost any other symptom. And thank goodness, because this is a legitimate warning sign you absolutely cannot ignore. Now, if you're running up 3 flights of stairs and you get winded, that's normal. I'm talking about something different. I'm talking about getting short of breath while you're folding laundry, getting short of breath while you're walking from your bedroom to your kitchen, getting short of breath while you're just sitting down having a conversation. Some people describe it as feeling like they can't catch a full breath. Others say it feels like someone squeezing their chest or sitting on their lungs. The technical term is dyspnea, but what it really means is that your heart is struggling to pump enough oxygen-rich blood throughout your body. Here's something crucial that a lot of people don't realize. Shortness of breath can actually be more predictive of heart disease than chest pain. You might have zero chest discomfort, but if your lungs are signaling that something's wrong with your circulation, you need to get checked out. I always tell my patients to do a simple self-test. Walk around your house at a normal pace. Can you hold a conversation without stopping to catch your breath? If the answer is no, and this is new for you, call your doctor. Don't wait. Don't assume it's your age or your fitness level. Call your doctor. Asterisk. Sign number 3. Pain, pressure, or discomfort in your arm, jaw, or neck. Asterisk. This is the one that sends shivers down my spine when patients describe it, because so many people dismiss it as completely unrelated to their heart. You wake up one morning and there's this dull ache in your left arm, or maybe it's your right arm. It comes and goes. It's not excruciating. It's just this persistent discomfort that you can't quite explain. So you think maybe you slept on it funny, maybe you strained it at the gym, or while gardening. You put some ice on it and forget about it. Meanwhile, your heart is literally screaming for help. The nerves that transmit pain signals from your heart also transmit signals from your arms, jaw, and neck. So when your heart is in distress, it often sends pain signals to these areas instead of your chest. It's called referred pain, and it's one of the most dangerous silent killers in cardiology because people just don't connect the dots. I had a man come in last year, Robert, 68, who'd been having pain in his jaw for about 6 weeks. He'd been to his dentist twice. His teeth were fine. He had no cavities, no gum disease, nothing. Then he came to see me because his wife was worried about his general health. I did an EKG and a stress test, and sure enough, his left anterior descending artery was almost completely blocked. That jaw pain was his heart attack warning signal. So pay attention if you're experiencing discomfort in your arms, especially your left arm. Pay attention to jaw pain that doesn't have a dental cause. Pay attention to neck pain that feels different from your usual stiffness. These might be nothing, but they might be everything. Asterisk, asterisk, sign number 4. Irregular heartbeat or palpitations. Asterisk, asterisk. This one's interesting because sometimes it's scary, and sometimes people don't even notice it's happening until someone points it out. Palpitations are when you become suddenly aware of your heartbeat. You might feel it racing. You might feel it skipping a beat. You might feel like your heart's doing somersaults in your chest. Some people describe it as a fluttering sensation. Others say it feels like they're having a panic attack. Now, your heart normally beats 60 to 100 times per minute, and you don't feel it at all. That's normal. But if you're sitting down watching television and suddenly you can feel your heart pounding in your chest, or if you feel it skip multiple beats, that's a signal worth investigating. There are various types of irregular heartbeats called arrhythmias. Some are completely benign, some are serious warning signs of underlying heart disease. The point is, you shouldn't have to wonder. If your heartbeat feels irregular to you, get it checked out. We can do an EKG in my office in about 5 minutes, and that'll tell us everything we need to know. I want to pause here because I can tell some of you are already starting to worry, and I want to remind you of something important. Having 1 or 2 of these symptoms doesn't automatically mean you have heart disease, but having these symptoms is your body's way of telling you that something needs to be evaluated. That's what I'm really trying to communicate here. This is about listening to your body and getting professional evaluation. Stay with me because we're only halfway through and the last 3 warning signs might be even more important than the first 4. Asterisk, asterisk sign. Number 5, swelling in your legs, ankles, or feet, asterisk, asterisk. This one's subtle, which makes it dangerous. You put on your regular shoes one morning and they feel tight, not slightly snug, they actually don't fit. You think maybe your feet are swollen from the heat or from walking around all day, so you kick off the shoes and forget about it. A few weeks later, you notice that when you press your finger into your ankle, the indentation stays there for several seconds instead of bouncing right back. You notice that your wedding ring doesn't fit anymore. You notice that when you wake up in the morning, your feet feel puffy. This is called edema, and it happens when your heart isn't pumping blood effectively, so fluid backs up into your legs and feet. It's like a traffic jam in your circulatory system. This is actually one of the earlier signs that your heart is struggling, and I'm frustrated by how often it gets overlooked. People think it's just part of aging. They think it's diet-related. They buy compression socks and hope it goes away. Here's what I want you to do. Right now, press your finger into your shin or your ankle for 5 seconds. If the indentation stays there after you let go, that's called pitting edema, and that's significant. If you're noticing new swelling in your lower extremities, especially if it's worse at the end of the day, and especially if it's symmetric, meaning it's on both sides, get it checked out. Asterisk, asterisk. Sign number 6, persistent cough or wheezing. Asterisk, asterisk. This one's tricky because persistent cough can be caused by a million different things. Allergies, asthma, acid reflux, smoking, a lingering respiratory infection. So people often don't connect it to their heart. But here's what I see in my practice. A patient comes in complaining about a dry cough that they've had for 2 or 3 months. They've been to their primary care doctor. They've been to an ENT. Nobody can explain it. We do imaging of their chest, and it turns out they have pulmonary edema, which means their heart's not pumping efficiently and fluid is backing up into their lungs. The cough is usually worse when you're lying down, which is why a lot of people think it's postnasal drip. They sleep sitting up, and that helps for a while, but the underlying problem, the heart problem, is getting worse. If you have a persistent cough that doesn't have an obvious cause, and it's been going on for more than a few weeks, especially if it's paired with any of the other symptoms I've mentioned, get your heart checked. It might be nothing, but it might be everything. Asterisk, asterisk sign. Number 7, dizziness or lightheadedness. Asterisk, asterisk. This is the final warning sign I want to talk about today, and it's particularly concerning in people over 60 because falls can be catastrophic. You stand up from your chair and suddenly the room starts spinning, or you feel like you're going to pass out. It only lasts a few seconds, but it's terrifying. So you sit back down and wait for it to pass, and you think, well, I probably just stood up too fast. But what if it happens multiple times? What if you're lying in bed and you roll over and suddenly the world is tilting? What if you're walking through the grocery store and you feel like you're going to faint? Dizziness can be caused by inner ear problems, low blood sugar, dehydration, and lots of other things. But it can also be a sign that your heart isn't supplying enough blood to your brain, or that your heart rhythm is irregular. I had a patient last year, Susan, 74 years old, who was experiencing frequent episodes of dizziness. She'd mentioned it to her primary care doctor, who checked her for inner ear problems and told her it was probably just part of aging. She came to see me, we did some cardiac testing, and we found that her heart was going into an unsafe rhythm every time she changed position. We fixed it with medication, and her dizziness completely resolved. The pattern I want you to recognize is this. If you're experiencing new dizziness, or if you're experiencing it more frequently than you used to, that's worth getting checked out. If you're feeling lightheaded during physical activity, that's definitely worth getting checked out. Don't just accept it as normal aging. Now, I want to give you something that ties all of this together because I've been talking about 7 separate warning signs, but here's the truth. The most important warning sign is change. Change in how you feel, change in your energy levels, change in your body. Your baseline at 70 is going to be different from your baseline at 30. I'm not asking you to panic at every little thing. What I'm asking you to do is pay attention to departure from your normal. If something feels different, if something feels wrong, that's your body's way of communicating with you. That's the real warning sign. Asterisk, asterisk. What you should do right now. Asterisk, asterisk. So let's say you've recognized one or more of these symptoms in yourself. What's the next step? Don't catastrophize. Don't spend the next 3 days on Google reading about worst-case scenarios. Instead, do this. First, call your primary care doctor and describe what you've been experiencing. Be specific about when it started, how often it happens, and how it's affecting your daily life. Your doctor might want to do some basic testing. They might want to refer you to a cardiologist like me. That's the appropriate path forward. Second, don't ignore it and hope it goes away. I have lost patients because they kept waiting for symptoms to resolve on their own. They kept thinking, well, maybe tomorrow I'll feel better. Maybe next week this will pass. Sometimes it does pass, but sometimes it's your only window to catch something serious before it becomes catastrophic. Third, if you're experiencing severe chest pain, severe shortness of breath, or you feel like you're actually having a heart attack, call 911 immediately. Do not drive yourself to the hospital. Do not wait to see if it passes. Call an ambulance. That's what we're here for. Asterisk, asterisk. Prevention is everything, asterisk. Asterisk. Here's something I wish every person over 60 would understand. We can actually prevent a lot of heart disease. I'm not saying we can prevent all of it. Genetics play a role. Luck plays a role. But lifestyle modifications can genuinely extend your life and keep your heart healthier. If you smoke, quit. I know that's easier said than done, but smoking is one of the most controllable risk factors for heart disease. If you drink alcohol, do it in moderation. If you're sedentary, start moving. You don't need to run marathons. A 30-minute walk 5 days a week can make an enormous difference. Eat a heart-healthy diet. That means less processed food, less salt, less saturated fat, more vegetables, more whole grains, more fish. Manage your stress. This is not just feel-good advice. Chronic stress literally damages your heart. Manage your blood pressure and your cholesterol. If your doctor has prescribed medication for these conditions, take it consistently. Don't skip doses. Don't decide you're going to stop taking it because you feel fine. And get regular checkups. After 60, I recommend my patients come in for a cardiovascular evaluation at least annually. If you have risk factors, more frequently. Asterisk, asterisk. The real reason I made this video. Asterisk, asterisk. I'm going to be honest with you for a second. I made this video because I see preventable tragedies every single week. I see people in their 60s and 70s who ignored these warning signs. I see their families struggling with the aftermath. I see spouses becoming caregivers, when with just a little bit of attention, a little bit of professional evaluation, things could have been completely different. And I see the opposite too. I see people who listened to their body, who got checked out, who got treated, who are now living full, healthy lives. The difference between those two groups often comes down to one thing: awareness. You now have that awareness. You know the 7 warning signs. You know that change is the thing to watch for. You know what to do next. So please, if you've recognized any of these symptoms in yourself, don't put this off. Don't assume you'll deal with it next month. Your heart has been working non-stop for your entire life without asking for anything in return except that you take care of it. It's time to return that favor. If you found this information helpful, please subscribe to this channel. I release new health content every single week, and my goal is to help you take control of your health before something goes wrong. Leave a comment down below telling me which of these warning signs surprised you the most. I read every single comment and I love hearing from you. Share this video with someone you care about who's over 60. You might genuinely save their life. And if you have other heart health questions, let me know in the comments. Maybe I'll make a video addressing your specific concerns. Thank you so much for watching. I'm Dr. William, and I'll see you in the next video.